Circadian rhythm sleep disorders is group of sleep disorders. Look at this picture, shows that daylight and suprachiasmatic nucleus in hypothalamus regulate sleep wake up cycle. Look at this. Look at this picture, sleep disturbances and pathophysiology. A detail going on. Introduction. Circadian rhythm sleep disorder are group of sleep disorders that results from misalignment between a person's internal biological clock and the external environment. The circadian rhythm, also known as the body clock, regulates the sleep-wake cycle and other physiological processes. Disruption in this rhythm can lead to sleep disturbances affecting overall health, cognitive function, and quality of life. Definition. Circadian rhythm sleep disorders are conditions where the timing of sleep is out of synchronous with the 24 hours daily cycle, leading to insomnia, excessive sleepiness, or both. These disorders occur when the internal sleep-wake rhythm is delayed, advanced, irregular, or non-existent compared to societal norms. Etymology. The term circadian comes from Latin words circa, meaning around, and diam, meaning day, referring to biological process that follow a rightly 24 hours cycle. Rhythm is derived from the Greek word rhythms, meaning a measured flow or regular pattern. Epidemiology. Circadian rhythm sleep disorders affect approximately 1 to 3% of the general population. With higher prevalence among adolescents, shift workers, and individuals with visual impairments. A delayed sleep wake base disorder is the most common types, especially in teenagers and young adults. Types 1. Delayed sleep wake base disorder, DSWPD. Sleep is delayed by 2 or more hours beyond conventional bedtime. 2. Advanced sleep wake-based disorder ASWPD. Sleep onset and awakening occur earlier than desired. 3. Irregular sleep wake rhythm disorder ISWRD. No clear sleep wake pattern. Sleep is fragmented into several naps. 4. Non 24-hour sleep wake disorder. Common in blind individuals. The circadian rhythm extends beyond 24 hours. 5. Shift work sleep disorder occurs in individuals working non-traditional hours. 6. Jet lag disorder. Temporary disorder due to rapid travel across time zones. Causes. 1. Genetic predisposition. 2. Lack of exposure to natural light. 3. Blindness. 4. Neurological conditions. Example dementia. 5. Irregular sleep habits. 6. Shift work or frequent time zone travel. 7. Hormonal imbalances. Melatonin secretion. 8. Age-related changes in circadian rhythm. Risk factors. 1. Adolescents and young adults DSWPD. 2. Elderly ASWPD. 3. Blind individuals N2-4SWD. 4. Frequent flyers. 5. Shift workers. 6. Individuals with mental health disorders. Example depression. 7. Poor sleep hygiene. Complications. 1. Chronic insomnia or hypersomnia. 2. Impaired cognitive performance. 3. Mood disturbances, depression, anxiety. 4. Increased risk of accidents. 5. Poor academic or job performance. 6. Weakened immune system. 7. Metabolic disorders. Example obesity, diabetes. Pathophysiology. The suprachiasmatic nucleus in the hypothalamus acts as the body's master clock, regulating circadian rhythms through light exposure and melatonin secretion. Look at this picture, shows that pathophysiology. In CRSDs, There is a misalignment between the internal clock and external cues. Disruptions in melatonin secretion and clock gene expression. Example PER clock gene play a central role in the pathogenesis of CRSDs. Here is a step-by-step pathophysiology of circadian rhythm sleep disorders. 1. Disturbance in the suprachiasmatic nucleus SCN. The SCN, located in the hypothalamus, acts as the master circadian clock. It receives light signals from the retina to regulate the sleep-wake cycle. Two, disruption of light-dark signaling. When light exposure is mistimed, example night shift travel, screen use at night, it sends incorrect signal to the SCN, causing desynchronization. 3. Disruption of light-dark signaling. When light exposure is mistimed, example night shift travel, screen used at night, it sends incorrect signal to the SCN, causing desynchronization. 4. Altered melatonin secretion. Melatonin produced by the pineal gland is normally secreted at night to promote sleep. In CRSDs, melatonin secretion is delayed, advanced, irregular, or absent. 5. Desynchronization of peripheral clock. Body organs and tissues also have their own clocks. Misalignment of the central clock causes peripheral clocks to fall out of synchronization, disrupting metabolism and hormone release. 6. Mismatch between internal clock and external environment. The person's biological clock no longer align with social or environmental cues, example day and night cycles, leading to difficulty falling asleep or waking up at desired times. 7. Sleep disturbance and daytime dysfunction. This misalignment causes insomnia, hypersomnia, poor sleep quality, and excessive daytime sleepiness. Signs and symptoms. 1. Difficulty falling asleep or waking up at desired time. 2. Daytime sleepiness or fatigue. 3. Poor concentration or memory. 4. Decreased performance at work or school. 5. Mood disturbances. 6. Fragmented or non restorative sleep. 7. Irregular sleep wake cycles. Diagnosis. 1. Sleep history and sleep diaries. 2. Actigraphy, wearable device to monitor rest activity cycles. 3. Polysomnography, overnight sleep study to rule out other disorders. 4. Melatonin rhythm testing. 5. Core body temperature monitoring. 6. Clinical questionnaires. Example: morningness to eveningness questionnaire, MEQ. Nursing diagnosis. 1. Disturbed sleep pattern related to altered circadian rhythm. 2. Fatigue related to inadequate sleep. 3. Risk for injury related to impaired cognitive functioning. 4. Anxiety related to inability to maintain normal sleep wake cycle. 5. Ineffective coping related to chronic sleep deprivation. Medical management. 1. Chronotherapy, gradual shifting of sleep time. 2. Bright light therapy, exposure to bright light to reset the internal clock. 3. Melatonin supplementation, especially in DSWPD and N2-4SWD. 4. Hypnotics or sedatives for short-term use in severe insomnia. 5. Stimulants or wake promoting agents, for example excessive daytime sleepiness. Nursing management. 1. Educate patients on maintaining consistent sleep wake cycles. 2. Monitor adherence to light or melatonin therapy. 3. Promote good sleep hygiene. 4. Reduce noise and light in the sleep environment. 5. Encourage regular physical activity, avoiding late evenings. Treatment options. 1. Light therapy. 2. Melatonin therapy. 3. Behavioral therapy. Cognitive behavioral therapy for insomnia, CBT1. 4. Sleep hygiene education. 5. Chronobiologic interventions, example sleep based shifting. Psychosocial medicine. 1. Cognitive behavioral therapy CBT to address negative thoughts and behaviors related to sleep. 2. Motivational interviews to encourage adherence to treatment and lifestyle changes. 3. Psychoeducation to help patients understand their conditions and management strategies. 4. Stress management techniques, relaxation training, mindfulness and guided imagery. 5. Support groups, sharing experiences and coping strategies with others facing similar issues. Prevention. 1. Maintain a regular sleep-wake schedule. 2. Get morning sunlight exposure. 3. Avoiding bright lights and screens before bedtime. 4. Practice good sleep hygiene, quiet, dark and cool environment. 5. Avoid caffeine, nicotine and heavy meals close to bedtime. 6. Use blackout curtains and noise reducing devices as needed. 7. Manage stress effectively. In conclusion, circadian rhythm sleep disorder are often underdiagnosed and can significantly affect daily functioning and overall well-being. With proper assessment and a combination of behavioral, pharmacological and psychosocial interventions, individuals can restore a healthy sleep-wake cycle. Thank you. Have a nice day.